Now, one experimental drug that has become a talking point in Nigeria is the Nano Silver. Last week, the health minister confirmed that the country had taken receipt of the drug and was set to administer it on Ebola patients in Lagos. But the plan was later abandoned amidst report that the drug is a pesticide. We asked the minister why the government chose to abandon that plan, and this is what he told us.
Nano Silver was brought to us, and we said, fine, we're not rejecting anything, because if you did, you also cause panic that you see the government is not interested if other governments are going. So we received it, but we put a condition that it must go through the stringent conditions for using experimental drugs, even in epidemics, as outlined in the Nigeria's National Health Research Ethics Code. We have a code already existing. We have a committee managing it. The minister appoints them, but they're independent of the minister, and their job is to advise the minister, and the minister takes their professional and expert advice. So when we brought it to our center here where we manage the patients, we said, hold on, let them go through it. Initially they gave a preliminary no because they wanted more information, and the scientists who supplied to us brought more information. They still went through it and were not satisfied that it met the minimum requirement. So they now advised that it should not be used. So there was now a definitive no. That is the reason why we didn't give it to any of the patients, and that's why we're not using it. Experimental drug is, well, it's more of psychological. It's not been proved. So you have seen what has happened in the case of America. The two victims are alive. So some people could suggest the experimental drug. But you also saw the Spanish priest who was also giving the same experimental drug passed on. In our own case, we are discharging someone who didn't have any kind of experimental. So we are still, in a way, using experimental drugs now is also like now beginning to carry out the clinical trials, because Ebola is not like malaria where you have ready patients who you can conduct clinical trials. So the only time you have opportunity to conduct some kind of clinical trial is when you have an outbreak. So we think the psychological benefit is useful. And then the idea that we can now run clinical trial is useful. So I endorse what the WHO has also said, that we indeed could use experimental drug. So Nigeria is asking for the same experimental drug. We're asking WHO, whatever Canada has given to you, share out to Nigeria also. We're speaking to US, can you share these experimental drugs with us? And also we have a team in Nigeria that the government just set up a couple of weeks ago and says the treatment research group for Ebola virus disease. They're also receiving all sorts of claims, but they are verifying claims, and it will then pass through the National Health Research Ethics Committee, and if they get clearance, and then we can deploy it. So I have nothing against experimental drug. The advantages are twofold, like I said. It now gives you opportunity to carry out that clinical trial, but it also gives the patients hope. And who knows, it may actually have the benefit that is being claimed.